Testing. Is this thing working? Yeah. This episode is about testing for the COVID-19 virus. While the MCO, which has just been extended to the 28th of April, will help to slow down the pandemic, just about every expert says that these social distancing methods have to go hand in hand with continued testing. As of now, there are two primary methods of testing for COVID-19. There's RT-PCR, which stands for Reverse Transcription Polymerase Chain Reaction. I know, rolls off the tongue, doesn't it? And then there's serological or antibody testing. With RT-PCR, basically
we want to target the genetic materials of the virus, which is an RNA, and then amplify it to an amount that is able to detect it by a machine or an instrument.
Why'd you cut me off like that? Lim Boon Chuan is working on developing a rapid test kit at Oxford University, where he's also finishing his PhD in synthetic biology.
RT-PCR is very accurate because they are detecting the virus itself. But the cons is definitely first, the price. You require a lot of different resources and components and reagents to run the test. And then also you require specialists or scientists to handle the sample, to run the test. And then also you need to use a specific instrument to run the amplification process. And then you will also need 1.5 to 2 hours for you to get the result.
Not to mention that the reagents that are needed, which are substances and mixtures used in chemical analysis, that stuff is in low supply. From US to Ireland, Canada, and even Sabah. In fact, Sabah only got its hands on supplies after an NGO stepped in to procure it from Singapore. But even that is expected to just last another 3 weeks.
So for antibody testing or serological testing, what someone needs to do is you first need to prick your fingers like a prick test for glucose testing, a droplet of blood onto the test strips, and then you wait for about 5 to 15 minutes, and then you will be able to detect the antibody that you produce. You can see it more like a secondary detection.
A lot of these rapid test kits out there, like the ones used in R.AGE's home testing service, use this kind of testing. They are functional, but
the test kit itself is actually detecting the antibody produced by the person, and it varies from person to person how someone will react to the virus. So normally it would take 3 to 5 days before you produce an antibody that can be detected on the test strips. You would definitely want to do a second test after you have the first one, because you might not actually be producing the antibody yet.
The test will also likely return positive results when used on recovered patients. That's because antibodies produced by the infection will stay in the patient's system for a long time. That's why most governments, including Malaysia, generally use RT-PCR tests. So accurate tests are slow and expensive, while cheap and fast tests are not accurate. That's a big problem during a pandemic, which is why experts around the world are rushing to design new and improved ways of testing.
What we're doing here in Oxford, the fundamentals are very similar to RT-PCR. We managed to reduce the duration of the amplification step down to half an hour, and we also doesn't require a very specialized instruments to run the test.
And in the United States, the Food and Drug Administration has approved a rapid test kit that gives a response within 5 to 13 minutes. Many other companies are reported to have testing kits pending approval. The reason for this is that testing the population and isolating those that are positive is crucial to turning around this pandemic. Unlike SARS, another form of coronavirus, COVID-19 is actually not very deadly. Many that get it do not show any symptoms and go around infecting others for days, which is why testing is so important. Positive cases are detected, put in isolation and tested, and interviewed for their contact history. Then, authorities carry out contact tracing, which is tracking down anyone that the patient may have had close contact with and testing them as well, so on and so forth. It's pretty much what South Korea did on a massive scale, and it's credited to helping them control the virus spread without establishing a nationwide lockdown. If it's so crucial, why haven't we done more testing? Experts have called for just that, citing examples like South Korea, where some 460,000 people have been tested so far. That's over 9,000 people tested per 1 million of the population. In Malaysia, we had 60,000 people tested so far, or around 1,700 per million. Well, that's a question our health DG answered, even before it was asked.
Are we testing adequately for our population? The benchmark of WHO is that if you have 10% positive, that is adequate in terms of the screening and testing for the community.
Malaysia's positive numbers are currently at about 7% of the total tested. This large percentage of negative cases might seem like a waste of our precious test kits, but it's a sign that our health authorities are casting a wide enough net when it comes to testing. So wide that many negative cases are tested as well. But there's still no harm in testing more, in making sure that as far as possible, no positive cases go untested. That's why there are plans to take our testing capacity up to 16,500 tests daily. This is crucial because testing data also shows a pretty significant number of pending cases. A backlog of samples waiting to be tested. These samples could reveal new infection clusters. So what we need to prepare for is the possibility of an increase in positive cases being reported as these samples get tested.
The more testing you do, the more cases you are expected to see, for sure. Whether or not these cases translate into health complications, those who require an ICU, those who require ventilators, we don't know, right? And whether or not all these cases translated to death, we don't know the answer as well. But we will expect to see the spike. Does it really mean a bad news?
Not necessarily, because the real purpose of the data is
for the government and for the country to make a decisions, to plan for a strategy for their next step. So knowing which part of the country having the most cases at the moment will help the federal government to allocate some of the resources, whether it's the doctors or ventilators, to those heavy infected regions, right?
This data has also allowed authorities to focus on very specific areas where there might be an outbreak. For example, the enhanced MCO on 2 flats in KL was because 15 people tested positive in those premises. Social distancing and movement restrictions are slowing down the spread of the virus. But to go on and beat it, we need to test as much as possible, isolate the positives, and test the people in their contact history. So if you have symptoms, go to MOH's website to find out how to get tested. Or watch our previous episode where we walk you through how to get that done. Can you keep it a bit down? You're a bit loud. I could really use some massage. How are you guys doing? The first couple of weeks were a bit tough for me, but humans are adaptive creatures. Hope you're doing well, keep staying at home, and more COVID-19 Newsflash is coming your way.